Hi, my name is Schuyler. I'm going to be your nurse today. Can you show me your armband? Alright, can you tell me your name and date of birth? And do you have any allergies? Okay, today I'm going to be undressing your wound, cleaning your wound, assessing it, and then re-dressing your wound, okay? I gave you pain medication 30 minutes earlier. Can you tell me your pain on a scale from 1 to 10, 1 being not so bad and 10 being the worst pain you've ever experienced? Okay, now I'm going to wash my hands and provide you with some privacy. Now I'm going to prepare all my supplies. Okay, now I'm going to raise the patient's bed to waist height for me. And now I'm going to put on gloves. And now I'm going to drape the patient so that all I see is their wound. I'm going to open my red bag. And place it somewhere that's easily accessible. Okay, now I'm going to start by gently removing the edges of the tape from the skin so I don't tear it. And I'm pulling it slowly towards the wound, all the way around. I'm going to assess for the amount of drainage. I'm going to assess for the odor of the drainage. And I'm going to assess for the color, if there's any color. And there's no drainage present. So I'm going to wrap this up. And I'm going to throw all this away in the red bag. Now I'm going to examine the wound. I'm going to examine the skin around the wound, and it's slightly pink, which is healthy, normal. And the edges are very, very even. The closure, the wound is beginning to close, and there are no drains present. So now I'm going to take off these gloves, and also throw these away in the red bag. I'm going to wash my hands. And I'm going to prepare my sterile field. don't need these, so I'm going to dispose of all this in the trash. Okay. Now, I'm going to pour my solution without splashing it into the basin. And now, I'm going to apply my sterile gloves. Okay, and now I'm going to proceed by cleaning the wound. I'm going to take some gauze and I'm going to wet it. And I'm going to start in the wound bed. I'm going to clean from the inside out, least contaminated to most, in one swipe. And after one swipe, I'm going to throw that away. Now I'm going to proceed by measuring the wound with a cotton applicator, pre-moisten. I'm going to measure the length of the wound. Which is about 13 centimeters. I'm going to measure the width of the wound, which is about 5 centimeters. Diameter of the wound, which is about 15 centimeters. The depth of the wound, which is about 10 centimeters. And I'm going to see if there are any tunnels in the wound by gently poking at the edges. And he has no tunnels, so I'm going to throw this away. Alright, now I'm going to fluff and moisten some of this gauze. And make sure I wring it out, I don't want it to be dripping. I'm going to get my other cotton applicator and I'm going to pack the wound. Or this way. I'm going to take some more dried 4x4s and I'm going to lay them across the wound. I'm going to take my ABD pad. I'm going to lay it down just like this. Okay, now I'm going to take off these gloves and I'm going to dispose of them. I'm going to tape down the edges of the wound, all 4 sides. And before I'm done redressing the wound, I have to initial date and time it. Okay, and now is when I would put more gloves on. Redrape the patient. And then clean up my area. Before I leave the patient's bedside, I'm going to lower their bed, put up their side rails, and give them a call light. I'm just going to take this garbage and I would go dispose of this. I would take off my gloves again. I'd wash my hands. And I would document the drainage amount, color, and odor. And in this case there were none. I would document the wounds, the color around the wounds, the skin. I would document the edges of the wound, closure of the wound, if there were any drains present. I would also document the patient's tolerance of the procedure, any cleaning or irrigation I did to the wound, the dressings used for the wound, and the patient's tolerance for the entire procedure.